Okay, so let's be real for a second. In our world, technical skill, that's just the price of admission, right? So, what really separates the good from the great, the top 1%, it's not about having the latest gadget or a new type of filler. It's about getting inside your patient's head. It's about understanding desire. Today, we're going to break down the psychology that turns a one time client into someone who's with you for life. We're talking about building a practice that isn't just busy, but truly iconic. So, you've done the work, you've honed your craft, your technique with a syringe is second to none. You know facial anatomy like the back of your hand. But then, you look at your schedule and there are these gaps. Why? What's going on? And the answer, I promise you, is not to work harder or, heaven forbid, lower your prices. It's about working smarter. It's about tapping into what really drives your patients to come back again and again. And here it is, the uncomfortable truth. In a market this crowded, being technically excellent just isn't enough to keep people coming back. The real key to unlocking that next level of growth, well, it's not another plaque on the wall. It's getting a handle on the deep psychological triggers that make a patient choose you, trust you, and keep choosing you for years. So, how do we start to understand those drivers? We have to decode desire itself. And look, this isn't some fuzzy, abstract idea. Neuroscience actually tells us it's a pretty predictable process. It's powered by 3 core engines, and we're about to break each one down. Okay, first up, wanting versus liking. Now, these sound similar, but in your brain, they are totally separate systems. And honestly, this is a distinction that so many practices completely miss. Wanting is all about dopamine. It's that rush of anticipation, the, oh, I gotta have that feeling, that gets a patient to book an appointment. But liking, that's the actual pleasure you get from the experience and the results. That's what creates real loyalty. Think about it. You might have this amazing Instagram reel that gets someone super excited. That's wanting in action. They book, they come in, but then what? A clunky checkout, a generic follow-up email. A week later, they feel kind of meh about the whole thing. They didn't really like the experience, and guess what? They're probably not rebooking. The smart move is to go all in on engineering an amazing post-treatment experience. That's what makes them feel great about their decision. And the results, I mean, they speak for themselves. 78%. One clinic hit a 78% rebooking rate, which is just huge compared to the industry average. How? By sending a simple post-treatment recovery care package to new patients. It doesn't have to be complicated. It could be a quick personal text from you the next day, checking in, or a free LED therapy session. These little touches, that's where you deliver the liking. That's how you turn a one-off transaction into a long-term relationship. All right, the second engine of desire is something called the hot-cold empathy gap. It sounds complicated, but the idea is simple. Basically, we're really bad at predicting how we'll feel or act when we're in a different emotional state. This explains everything about why a patient's mindset can do a complete 180 from when they're chilling at home to when they're sitting in your consultation room. So picture this. At home, on their couch, scrolling your website, your potential patient is in a cold state. They're logical, they're just gathering info. But the second they're in your office, looking at a high-def image of their face, their emotional state flips to hot. Suddenly, desire is dialed up to 11. So your job is twofold. First, use your website to bridge that gap, help them feel what it's like to be in your clinic. And then, once they're there, make it incredibly easy for them to say yes. And finally, our third engine, the want-should conflict. Oh man, this is the big one. This is that little internal war that's happening inside every patient's head. It's the voice that says, I really want this, fighting with the other voice that says, I should be saving this money, or I should just be natural. You know that classic objection, I need to think about it? Yep, that's the want-should conflict right there. And helping your patient resolve it, that's the whole ballgame. Okay, so that internal battle we just talked about, it all comes to a boiling point in one place, your consultation room. So let's dive into how we can use these psychological principles right there in that critical moment to turn a simple conversation into a conversion. Your secret weapon here is something called mental simulation. The research is crystal clear on this. The more vividly someone can imagine an experience, the more they desire it. So don't just show them a 3D image. Talk to them. Describe how their skin is going to feel so much smoother. Paint a picture for them. Imagine walking into that big meeting next month feeling totally confident. And then ask them future-pacing questions like, 3 months from now, when you catch your reflection, what's the very first thing you're going to feel? You're basically letting their brain test drive the results. Now, it's totally normal for patients to feel conflicted, a little excited, a little nervous. The worst thing you can do is ignore that. Instead, you use what's called a validation bridge. It's so simple, but so powerful. You just say something like this. A lot of my patients feel excited and nervous at the same time, and that makes total sense. You're making an investment in yourself, and you want to be sure the results feel like you. Instantly, their guard comes down. You're not selling them something, you're on their side. So how do you help them win that want-should battle? You give them permission, you provide justification. There's a psychological principle called licensing, and it's all about giving someone a rationale that lets the should part of their brain relax and agree with the want part. It can be as simple as saying, you've worked so hard this year, you absolutely deserve this. Or framing it differently, when you feel this confident, you show up as a better parent. You're literally giving them the reason they need to feel great about saying yes. Of course, that consultation gets a whole lot easier if the patient walks in already feeling that desire. And that, my friends, is where your marketing comes in. We're talking about how to take someone from just mindlessly scrolling on their phone to actually booking an appointment with you. Here's a huge shift in thinking for you. Stop marketing to demographics and start marketing to a psychological state. Think about it. The person scrolling Instagram on a stressful Tuesday night is in a totally different headspace than that same person researching options on a lazy Saturday morning. When you tailor your message to their context, what they're feeling right then and there, your content is going to hit so much harder. And if you're launching something new, please don't just post about it once. Build the drama. Create an anticipation campaign. Remember that dopamine system we talked about? It goes crazy for rewards that are both desirable and a little uncertain. So you hint at something new, you build curiosity over a few days, then you do the big reveal with an exclusive offer. You're creating authentic excitement and urgency, and you'll see a wave of bookings when you go live. And a quick word on your visuals. They have to do more than just show a before and after. They need to spark that mental simulation we talked about. So yeah, the static photos are fine, but what about a video of that patient a month later, just laughing and glowing with confidence? Show them living the result. That's what lets a potential patient mentally try on the outcome, and it makes their desire to book feel real, tangible, and honestly, pretty urgent. Look, all these tactics for your marketing and your consultations, they work. They're powerful. But they're really just pointing to something much, much deeper. Because mastering desire isn't just about a clever business strategy. It's about completely reframing how you see your role as a practitioner. Here's the thing. Your patients aren't coming to you to buy filler. They're not buying Botox. They are buying a version of themselves that finally matches the person they feel they are on the inside. What you are really delivering is identity affirmation. And when you get that, that's the insight that separates the good from the truly great. Just think about it. That 30-year-old new mom who comes to see you, she doesn't actually want botulinum toxin. What she wants is to look in the mirror and see herself again. She's driven by this incredibly deep need to reconnect with her identity before the sleepless nights and the stress. When you understand that, you stop being just a technician and you become a genuine partner in her journey. Honestly, this is where the entire industry is going. Perfect technical skill is going to be the absolute baseline. It's the minimum requirement. The practitioners who are going to truly thrive in the next decade, they'll be the ones who get that every single syringe, every single consultation, is a chance to connect with a patient's fundamental need to feel seen, to feel understood, and to feel desirable. So I'll just leave you with this one question to think about. A question that really challenges you to look past the procedure and see the person. Are you selling procedures or are you facilitating transformations? Because your answer to that, well, it's going to define everything.